Hello, this is Dr. Gay from First Leg MRI, and this is a 53-year-old female who had an injury of her index finger. The pain didn't go away, it just became more severe over time. She had swelling. They did x-rays, and the x-rays were normal. If you look at this region here, there's no evidence of a displaced fracture. The joints look great, and let's see if we scoot this over. We don't see any abnormality. This was the region of concern. Here we go. So they did an MRI scan, and on the MRI it looks like there's maybe some mild low T1 signal here, some edema, so we can confirm that with this T2 fat sat sequence. So we have a stress injury here, a non-displaced fracture, a stress fracture of the proximal phalanx. We see the collateral ligaments look good, and now we're going to look at the tendons, ligaments. With the ligaments there, collateral ligaments look good. Now the flexor tendon looks great. Here we have the extensor tendon, and so we have the central slip. And this part here comes up, and then it attaches right here at the base of the middle phalanx, and there are the lateral bands that come along the side here, and will come over here and attach over here distally. And on this view, you see lots of soft tissue swelling here, so that's suspect. If we go one way or the other, it looks halfway decent, so we have some T2 weighted images now. And this is a fat sat PD image. This is along the ulnar aspect of that central slip. If we go towards the central part and along the radial aspect, we see there is a little perforation right here. So there's a small full thickness tear of the central slip. Again, the ulnar fibers are intact, so it's not a complete rupture. And there it is right there. So we're going to look on the axial images to confirm. And here we go. This is the index finger. This is the proximal phalanx. We're going to go distally. And there it is. So you see this split right here. This is the central slip. And over here on the sides, we're going to get into the lateral bands. And we see that the central slip, if we go all the way to the middle phalanx here, this is part of the central slip that's intact. So it's not completely ruptured, just a tear along the radial margin there. So a full thickness tear, incomplete, but a full thickness tear of the central slip. Now the lateral bands are very small, hard to see, but this is probably one over here on the radial side. This is one on the ulnar side. You're going to go distally. There they are there, coming together, attaching here on the distal phalanx. This is the distal phalanx. You can see those lateral bands coming across. Here they are. And then here you can see that full thickness tear of the central slip. And there it is again. Of course, these are very easy when they're ruptured because you can see it clearly, but in this case, you can only see it here on the T2 images. And of course, the big giveaway, lots of soft tissue swelling and the significant injury here of the head of the proximal phalanx. And that's it. Thank you very much.